Hey there, come on in, sit down for a minute today. I want to talk about something that might go against pretty much everything you've heard on TV from wellness influencers, or even from that super healthy aunt at Thanksgiving dinner. We're talking about cashews and almonds. Now, I know what you're thinking, Doc, those are health foods. They're good for your heart. They have omega-3. They prevent cancer and aging. And for some people, yes, absolutely. But for many of my patients, especially folks over 50 or 60, those same superfoods can quietly, silently put a real strain on your kidneys. And the health shows, they almost never tell you that part. The story that changed how I talk about this, let me tell you about a patient of mine. I'll call her Mrs. Johnson, Shes 68, a retired elementary school teacher, lives in the suburbs, drives a Honda CRV, loves her garden. She came into my office last month with her annual lab results in her hand, and she was crying. Now, Mrs. Johnson is the picture of healthy living every single morning, rain or shine. She walks 2 miles at the local park, then she comes home, sits down with her breakfast, and eats her healthy nuts, a handful of cashews, a handful of almonds. Never misses a day. She looked at me and said, I'm doing everything right. The experts on TV said nuts are good for me. So why are my kidneys getting worse? Her creatinine was elevated. Her GFR, that's the filter rate of her kidneys, was lower than it should be, and she had no idea. That's the thing about kidneys. They are painfully quiet. They can lose 30, 40, even 50% of their function before you feel a single thing. No pain, no swelling, no warning. You feel fine until one day. You don't. The real numbers, plain and simple, according to major public health data, the kind we trust at the CDC and the American Kidney Fund. About 1 in 10 adults in this country has some form of chronic kidney disease. That is a huge number, and here's what scares me as a doctor. By the time most people find out, their kidney function has already dropped significantly. We're talking about the possibility of dialysis 3 times a week, 4 hours a session. That is exhausting, expensive, and hard on your body and your family, or a kidney transplant. And let's be honest, waiting lists are long. So today we're going to do something different. I'm going to tell you 3 nuts I really want you to be careful with, especially if your creatinine is even a little high, or if you're over 63 nuts that are actually kidney friendly. Exactly how many to eat, when to eat them, and how to avoid the most common mistakes. And yes, what happened to Mrs. Johnson? Because 6 months later, her creatinine came back completely normal. She hugged me and said, I can finally play with my grandkids again without being terrified. If that sounds like something you want for yourself or someone you love, hit that like button. Let's get to work. Disclaimer, this is for educational purposes only. Always consult your own doctor before making changes to your diet or medications. The 3 nuts to be careful with, let me say this clearly. If your creatinine is above normal, or you've already been told you have early chronic kidney disease, these are the nuts I want you to consider removing from your pantry. Not because I'm trying to scare you, because I've seen what happens when people don't eat cashews. Cashews are the #1 nut I worry about for kidney health, and here's why. In 100 grams of cashews, that's about a medium-sized handful, you get roughly 660 milligrams of potassium and about 590 milligrams of phosphorus. Now, those numbers don't sound dramatic, but let me explain what they mean inside your body. Think of your kidneys as a dam. When they're healthy, they open the gates to let extra potassium out when you have too much and close the gates when you need to hold on to it. It's a beautiful system, but when kidney function starts to decline, even a little, that dam gets stiff. The gates don't open all the way. Potassium builds up in your bloodstream. That's called hyperkalemia. That word sounds academic. But here's what it feels like: muscle weakness, numbness, or tingling in your hands and feet, a slow, irregular heartbeat. And in severe cases, the kind I've seen in the hospital, the heart can actually stop. A major medical center here in the US published research showing that even moderately high potassium levels increase the risk of sudden cardiac events. This is not theoretical, this is real. And the phosphorus that builds up too. When phosphorus gets too high, it starts pulling calcium out of your bones become brittle, easier to fracture. Meanwhile, that calcium doesn't disappear. It deposits into your blood vessels, your arteries get stiff. That's vascular calcification. That's a direct driver of heart attacks and strokes. So when Mrs. Johnson told me she felt her heart racing just walking up 2 flights of stairs, that wasn't getting older. That was her potassium creeping up. Almonds. Almonds are everywhere. Almond milk, almond flour, almond butter. And yes, they have vitamin E. Yes, they're good for your skin, but for your kidneys, there's a real problem: oxalates. Roasted almonds contain a very high amount of oxalates. In fact, per 100 grams, Almonds have roughly double the oxalates of cashew. So what's an oxalate? It's a natural compound that in your urine binds with calcium and that forms calcium oxalate crystals. Those crystals turn into kidney stones. Here's a stat I want you to remember. Nearly 80% of all kidney stones in the US are calcium oxalate stones. 80%. Now, a single stone is painful enough. I've had patients tell me it's worse than childbirth, but the bigger problem is what happens over time. Those crystals, even before they form a big stone, can physically irritate and scar your kidney tissue. They can block the tiny tubes inside your kidney. That drives creatinine up, and it can happen slowly, silently. I had a patient, 62 years old, retired auto mechanic, who ate about 150 grams of almonds every day for over a year. He thought he was being so healthy. When we finally did an ultrasound, his kidneys were full of tiny crystals like sand. We caught it early enough, but it took months to clear. And here's the kicker. Many people in this age group don't drink enough water, especially if you're worried about getting up at night to use the bathroom. So you cut back on water in the evening. That makes your urine more concentrated, and concentrated urine plus high oxalates equals a perfect storm for kidney damage. Mrs. Johnson told me, but I bought the expensive organic almonds from Whole Foods. And I said, Mrs. Johnson, I love you, but your kidneys don't care about the price tag, pistachios and peanuts. I'm putting these two together because the problem is similar. Pistachios themselves are moderately high in potassium. But here's the real issue. Almost all pistachios you buy at the store are salted. Salted roasted pistachios. That means you're getting sodium and potassium together. That's a double load on your kidneys. And peanuts are technically legumes. They grow in the ground, but most people treat them like nuts. And peanut butter is even worse, added sugar. Added salt, sometimes palm oil, that's not kidney friendly. Now, I need to be very clear about one group. If you're already on dialysis, these two, pistachios and peanuts, are not your friends. When you're on dialysis, your kidneys are barely working. The potassium you eat stays in your blood until your next dialysis session. If you eat a lot of high potassium foods in between sessions, your potassium levels can go dangerously high. And because dialysis patients often have other heart problems, that high potassium can be life-threatening. Major academic medical centers here in the US list nuts, especially salted nuts, in the same category as things like sardines, processed cheese, and broths. Things you need to be very careful with. So let me repeat: cashews, almonds, pistachios, peanuts. If your creatinine is even a little bit elevated, or if you've been told you have chronic kidney disease, these are the ones I want you to consider clearing out of your house today. Don't worry about the money you spent. Your body is worth more than a $7 bag of nuts. The 3 kidney-friendly nuts. Now, please don't hear what I'm not saying. I'm not saying all nuts are bad. That would be bad medicine. There are 3 nuts that are actually helpful for most people with early kidney concerns. I call these the kidney-friendly 3 macadamia nuts. If you are eating cashews right now, this is your swap. Macadamia nuts have roughly half the potassium and half the phosphorus of cashews or almonds. That alone is a huge win, but here's what I really love about them. Macadamias contain a type of fat called palmitoleic acid. Think of it as a firefighter for your kidneys. It helps reduce chronic low-grade inflammation. And why does that matter? Because when kidney function starts to decline, it's often driven by silent inflammation inside the kidney tissue. Tiny fires burning all the time. Palmitoleic acid helps put those fires out. Macadamias also help stabilize blood sugar. And here's a fact: many people with kidney disease also have diabetes or prediabetes. Diabetes is one of the leading causes of kidney failure in the US, so anything that helps steady your blood sugar takes real pressure off your kidneys. How many? 10 to 15 macadamia nuts per day. That's about 30 grams. Don't go over that. Macadamias are high in calories and carrying extra weight. Especially belly fat is also hard on your kidneys. Walnuts, 6 to 7 walnuts a day. That's the sweet spot. Walnuts are the only nut that's rich in plant-based omega-3 fatty acids. The type called you've heard about omega-3 from fish. Salmon, tuna, sardines, those are great, but walnuts give you a plant version that works really well for many people. In 2021, a major peer-reviewed medical journal published a study showing that even a small increase in plant-based omega-3 intake was associated with about a 5% lower risk of dying from a heart attack or stroke. Now, you might be thinking, that's heart health. I'm here for kidneys. Here's the connection. Your kidneys and your heart are like brothers. They don't get sick alone. If your heart is struggling, your kidneys usually are too. And if your kidneys are struggling, your heart is at higher risk. The omega-3 in walnuts help keep the tiny blood vessels inside your kidneys flexible and strong. Those vessels, called capillaries, are what actually filter your blood. Healthy vessels, healthy filtration. A well-known US university did a study where they asked people with heart risk factors to eat walnuts every day for 6 weeks. At the end of those 6 weeks, their blood pressure was lower, their LDL or bad cholesterol was lower, and their gut microbiome, the healthy bacteria in their intestines, was significantly better. All of those changes take direct workload off your kidneys. 6 to 7 walnuts. That's the American Heart Association's recommended amount. More than that, and you're just adding empty calories. Flaxseed. Now, flaxseed isn't technically a nut, it's a seed, but I include it here because it works so well alongside walnuts and macadamias. Here's the golden rule with flaxseed: 1 tablespoon with 8 ounces of warm water. That's about 240 milliliters. This is not optional. You'll see why. About 30% of flaxseed is dietary fiber. It's a fiber bomb in a good way. That fiber does 2 wonderful things. First, soluble fiber acts like a sponge. It binds to waste products that your kidneys have already filtered out of your blood, things like excess urea and toxins, and helps your body move them out through your intestines. Your gut literally helps your kidneys take out the trash. Second, insoluble fiber keeps things moving through your digestive system. The less time waste sits in your body, the less chance it has to be reabsorbed. Flaxseed also has those same plant-based omega-3 as we talked about with walnuts, so you get a double benefit, but you absolutely must drink water with it. When fiber hits water, it turns into a gel. That gel is what grabs onto the waste. If you eat dry flaxseed without enough water, it doesn't become a gel, it just sits there. And in some cases, it can actually cause constipation or rarely a blockage in your intestines. So again, 1 tablespoon of flaxseed, 8 ounces of warm water every time. A quick note on chestnuts. I get this question a lot. What about chestnuts? Chestnuts are actually low in oxalates. So for people with kidney stones, they're a safer choice, but chestnuts are much higher in starch. If you have diabetes or prediabetes, go easy on them. If you don't have blood sugar issues, chestnuts are generally fine. Complete kidney-friendly daily schedule. Mrs. Johnson asked me for a specific, easy-to-follow daily plan. So here's exactly what I told her. Morning, right after you wake up, 6 walnuts, 8 ounces of warm water. Why morning walnuts are gentle on an empty stomach. And your body absorbs the plant-based omega-3. That's best in the morning before you've eaten other fats. That warm water helps flush out the metabolic waste your kidneys processed overnight. Many people wake up slightly dehydrated. That first glass of water is like opening the doors to your kidneys office for the day. After lunch, 1 tablespoon of flaxseed, mix it into yogurt, cottage cheese, or sprinkle it on a salad. Another 8 ounces of warm water. Again, that water is not optional. The flaxseed needs it to form that gel afternoon snack. 10 to 15 macadamia nuts. But here is the single most important rule I give all my patients. Please write this down in your head. Only 1 type of nut per day. Do not mix. Do not have walnuts in the morning and macadamias in the afternoon. Do not sprinkle flaxseed on your lunch and then have walnuts as a snack. Why? Because once you start mixing, you have no idea how much potassium, phosphorus, and calories you're actually eating. You will almost certainly go over the safe limit. Pick 1 nut for the day, that's it. At dinner, eat more vitamin C rich vegetables, bell peppers, broccoli, spinach, Brussels sprouts. Vitamin C helps your body use those omega-3s more effectively. It's also a powerful antioxidant that protects kidney cells from everyday wear and tear. Total daily nuts, no more than about 30 individual nuts total, across whatever single type you choose. And if you're someone who loves variety, rotate days. Monday walnuts, Tuesday flaxseed, Wednesday macadamias, Thursday walnuts. Again, that's fine. Just don't mix within the same day. Drop a comment and let me know if this schedule feels doable for you. Just type 1 so I know you're following along. Answers to the 3 questions I get asked most often. Question 1, my creatinine is in the normal range. Do I still need to worry about this? I love this question, and the answer is maybe creatinine is a useful test, but it has a blind spot. It's affected by how much muscle you have. If you're a larger person or someone who lifts weights, your creatinine might look slightly high even if your kidneys are perfectly fine. On the flip side, if you're older and you've lost muscle mass, which happens naturally as we age, your creatinine might look normal even if your kidney function has actually dropped. That's why many kidney specialists now recommend another blood test called cystatin C. It's not affected by muscle mass. It gives a much clearer picture of true kidney function. If you're over 60 or if you have high blood pressure or diabetes, I would suggest asking your doctor about checking cystatin C once a year. It's a simple blood draw and it can catch problems earlier than creatinine alone. Question 2, my creatinine is already high. Is it too late to change? It is not too late, but you need to do two things immediately. First, make an appointment with a kidney specialist, a nephrologist. This is not something you can fix with internet articles alone. A specialist will do the right tests and tell you exactly what stage of kidney disease you're in. Second, while you're waiting for that appointment, stop the cashews and almonds. Increase your water intake to about 1.5 to 2 liters per day unless you're already on dialysis. If you're on dialysis, do not increase water without your doctor's approval. That's very important. Question 3. Is there anything else that can mess up my creatinine test? Yes, two things. One, eating a lot of red meat, beef, lamb, the night before a blood test can temporarily spike your creatinine. So if you're going for a kidney check, maybe have chicken or fish or a vegetarian meal the night before. Two, intense exercise. If you go for a hard run or a heavy lifting session right before your blood draw, your muscles break down a tiny bit and that releases creatinine. So get your blood drawn on a rest day in the morning after drinking some water, but before heavy exercise. What happened to Mrs. Johnson? I promised I'd tell you the rest of her story. Mrs. Johnson went home after that first appointment and she did something hard. She opened her pantry, took out every bag of cashews and almonds, including the expensive organic ones, and threw them away. Her husband said, "Honey, that's like $40 of nuts." And she said, "I'd rather waste $40 than waste my remaining kidney function." Then she started the daily schedule I just gave you. 6 walnuts in warm water every morning, flaxseed on her lunch salad, 10 macadamia nuts in the afternoon, broccoli or bell peppers at dinner. And she spread out about 2 liters of water across the day, a small cup every hour or so. 2 months later, she came back for a follow-up. Her creatinine had already started to come down. Her potassium was back in the normal range. She wasn't having those heart-racing episodes anymore, but she was still nervous. She said, "Is this real or is it just a temporary change?" I said, "Mrs. Johnson, let's give it more time. Keep going." 4 more months passed, 6 months total from that first crying visit. She came in for her next annual physical, and when I pulled up her labs, I actually smiled. Her creatinine was completely normal. Her GFR, that kidney filter rate, had gone from moderately reduced to ideal for her age, completely normal. She started crying in the exam room, real tears, and she said, "I really thought I was headed for dialysis. I thought I'd never see my grandkids grow up, and now I just got back from a trip to the mountains with my husband. We went hiking. I wasn't even tired." Her husband was sitting next to her. He said, "The whole family sleeps better now. The kids don't have to worry about mom anymore. That is why I love being a family doctor, not because of the fancy equipment or the medical journals, because of moments like that, and none of it required an expensive medication or a surgery. It required one small consistent change in her daily eating habits." One more warning. This one is important. Before we wrap up, I need to tell you about something that is actually harder on your kidneys than nuts. It's a class of over-the-counter pain relievers called NSAIDs. You know them as ibuprofen, Advil, Motrin, naproxen, Aleve. Here's the scenario. You're 55, your back hurts from gardening or from sitting at a desk all day. So you go to Walmart or CVS, you buy a bottle of Advil and you take it for a week or 2 weeks or every day for a month. What happens inside your kidneys? These medications constrict the blood vessels that feed your kidneys. They reduce blood flow to the kidney tissue. Over time, that directly raises creatinine. And if you take them long enough, they can cause permanent kidney damage. I am not saying you can never take ibuprofen again for a headache or a sprained ankle, but if you have chronic pain, back pain, arthritis, old sports injuries, please do not just buy bottles of NSAIDs and take them every day. Talk to your doctor. There are safer options for long-term pain management, including topical creams, physical therapy, and other medications that don't hurt your kidneys. This is one of those things that most people don't know, and I want you to know it. Let's land the plane. So here's where we are. Not every superfood is a superfood for your specific body. Cashews and almonds are great for a healthy 25-year-old with normal kidney function. For someone who is 65 with slightly elevated creatinine, those same nuts can be a real problem. But you have power here. You are not a victim of your lab results. You can swap in macadamias, walnuts. And flaxseed, you can follow that simple daily schedule. You can drink enough water. You can be careful with over-the-counter pain relievers. And if you do those things consistently, not perfectly, but consistently, your kidneys will thank you. 3 things I want you to do today. Go look in your pantry and your fridge. If you see cashews, almonds, pistachios, or peanuts, especially salted ones, consider moving them out. Don't feel guilty about the money. Your body is worth more than a bag of nuts. Share this video with one person you care about, especially if that person has high blood pressure, diabetes, or a family history of kidney problems. Your share might be the thing that changes how they eat. If you have any questions, or if you've tried this schedule and want to tell me how it's going, drop a comment. I read as many as I can. I can't give personal medical advice in the comments. That wouldn't be safe or legal, but I can point you toward good resources. A final thought. Your kidneys are quiet heroes. They work 24 hours a day, 7 days a week, filtering your blood, balancing your minerals, keeping you safe. They don't complain. They don't send pain signals until things are pretty far along. So let's be proactive. Let's not wait for a scary lab result. Let's make small, smart changes today. If you're dealing with any health concerns, kidney related or otherwise, please schedule a visit with your primary care doctor. I'm here to help you understand the science. I'm not here to replace professional medical advice. Thank you for trusting me with your time. Thank you for caring about your health. If you found this helpful, hit that like button, subscribe if you haven't already. Ring the bell so YouTube actually shows you the next video. I'll see you in the next one. Take care of yourself. Really, you matter. Bye for now.